And welcome back to Idaho Today. You know, being on the road to recovery can be difficult, and having the support of your loved ones can make all the difference. Intermountain Hospital's outpatient services allows a way for people to start the recovery process from the comfort of their home, surrounded by a support system. So we spoke to Jay Hurst from Intermountain Hospital to learn more. Jay, it is so great to see you, and I would love for you to tell us a little more about yourself so our viewers that are not familiar can learn. Tell us about yourself and your background, especially with Intermountain Hospital.
Pleasure to talk with you also. So my background is originally I started out as a registered nurse, and then I did some additional education as a family nurse practitioner. And then where I was at in a very rural area, I wanted to provide more psychiatric care for the community that I was in. And then my family had the opportunity to move here to Boise to take care of my mother-in-law who had Alzheimer's. And as we moved here, had the opportunity to work with Mid-Valley Health and work at Intermountain Hospital helping patients feel better.
I love that, helping patients feel better. And tell us too about your role at Intermountain Hospital, because you have a big one. What is your role there?
So my role is as a psychiatric mental health nurse practitioner. It's a mouthful. But my role is to better assist patients in figuring out their mental health, the options that are available to them, and finding stability for them, because obviously they've made it to the hospital, something has not gone right in their life, and we're just helping them find some stability that works for them.
Yes, and just talking with you is very comforting and calming, I have to say. I can just imagine how delightful it is to work with you at Intermountain Hospital.
Thank you for saying that.
And your role, though, obviously is a very important one. Tell us, though, too, how you work with a team, right? You work with a team, you come together, and you develop some of the best programs for each of your patients. So how do you go about doing that?
We actually do that on a daily basis. It's pretty exciting. So we have nurses who are constantly with the patients. We also have social workers who are absolutely amazing, helping work through family details, contacting what we call collateral information, other people that may be of assistance to patients in the community and at home. And then we have me, and usually I'm working on medications. I'm also working on treatment plans to better figure out therapy to assist patients at finding more stability.
Wow, so it sounds like a really comprehensive approach.
Very much so.
Yeah, you're focusing on all the touch points for that patient, likely to really improve a positive outcome, right?
Yes.
Yeah, okay. And then also, too, help us understand how the treatments differ from somebody who's an inpatient versus an outpatient.
So inpatient, it doesn't matter if you're going to St. Luke's or St. Al's. An inpatient provider is always working towards figuring out stability. So we have a mental health crisis. We just want someone to be stable. While on an outpatient basis, rather than treat them and street them, we are working towards more comprehensive, figuring out long-term how to better assist somebody, find the stability that they want and need.
Okay, and I love that. Find the stability they want and need, not only while you're treating them, but also beyond, so they can be successful through life, not just in the time period that they're with you, right?
Yep, a lot of times it's like, so a cardiologist, when you discharge from a hospital, will get you set up with a primary care provider, medical provider, primary care provider, physical therapy maybe, a dietitian. In with psychiatric care, when they discharge from the hospital, they may need something a lot like occupational therapy. However, for occupational therapy for psychiatric concerns, they have PHP and IOP programs. So similar.
I'm so glad you put it in that perspective, right? Because I feel that so many of us are very comfortable and familiar with the thought of physical illness, right, and how we approach that, and we accept the fact that there's going to be a process to recovery and to healing through it. But I think that understanding mental health, that there's also a process and a path of healing that happens with that, that seems to be a bit of a new a new way of thinking, a new perspective for some. So I really appreciate you putting it in those terms, because I think it becomes a lot more relatable for people and easier to accept, right? Okay, where can people go so they can learn more about Intermountain Hospital, both inpatient, outpatient services, how you can help them?
You're able to contact Intermountain Hospital 24/7 through the telephone. You're able to find that on the internet, and I assume we still have yellow pages.
If those still exist, yes. But if anything, likely go to the website.
Yep.
I imagine all your information is there, right?
The website, absolutely. And then during regular business hours, you're always welcome to walk in to Intermountain Hospital and ask questions too.
Wonderful. Jay, thank you so much. Greatly appreciate everything you do.
Thank you for having me.